How does the VA evaluate the severity of Parkinson's disease for disability ratings? To understand how the Department of Veterans Affairs evaluates Parkinson's disease for disability ratings, we need to look at their structured process. This evaluation focuses on both the diagnosis and how symptoms affect daily life and work. First, a formal diagnosis from a certified neurologist is required. In some cases, veterans with symptoms similar to Parkinson's may also be considered, especially if linked to conditions like exposure to Agent Orange. The VA uses diagnostic code 8000 in the schedule of ratings for neurological conditions to assign disability ratings. The minimum rating for Parkinson's disease is 30%. This rating is given when there are ascertainable residuals of the condition. Essentially, any veteran with a confirmed diagnosis and ongoing symptoms will receive at least this minimum rating. However, the evaluation process goes beyond just the minimum rating. The VA examines specific symptoms and complications associated with Parkinson's disease. These can include tremors, muscle rigidity, slowed movement, balance issues, speech changes, and loss of automatic movements. Each of these symptoms can be rated separately under the appropriate diagnostic code for that bodily system. For instance, if a veteran experiences significant tremors or speech difficulties, each of these symptoms may receive its own rating. The VA then combines these individual ratings using a special formula to determine the overall disability rating. If the combined rating exceeds the minimum 30%, the veteran will receive the higher rating. If not, they will remain at the minimum rating. Additionally, many veterans develop secondary conditions related to Parkinson's disease. These can include arthritis, heart conditions, hypertension, fatigue, pain, mental health issues like depression or anxiety, urinary tract infections, constipation, and sleep disorders. If these conditions are connected to Parkinson's, they may also be rated separately and included in the overall disability calculation. The VA's approach ensures that veterans receive compensation that accurately reflects the impact of their illness on their daily activities and work capabilities. This thorough process considers both the diagnosis and the full range of symptoms and complications. For patients and their families, understanding this evaluation process is crucial for navigating the VA benefits system. It emphasizes the importance of thorough medical documentation and regular communication with healthcare providers. This ensures all symptoms and related conditions are properly reported and evaluated. In summary, the VA evaluates the severity of Parkinson's disease by confirming the diagnosis and assessing the presence and impact of symptoms and related conditions. The minimum disability rating is 30%, but the actual rating can be higher based on the combined impact of symptoms. This system aims to provide fair and appropriate compensation for veterans with Parkinson's disease, reflecting their service-connected disabilities.